Thank you, Larry. Good afternoon. I'm Patrick Spain. I'm the co-founder of First Stop Health, which is a patient-centric online health concierge service. Our goal is to make your interaction with the American health system more convenient, more efficient, and yes, more pleasant. So the opportunity we see out there is that accident and illness do not happen during normal business hours. The establishment largely operates during normal business hours. So we think there's an opportunity to address health issues after hours. And when you look at the looming healthcare shortage of primary care physicians, only 2% of doctors coming out of medical school want to go into healthcare. We think that even if you want to address your problem during normal business hours, you will not be able to. Also, the healthcare system lacks coordinators for serious diseases. You tend to go from one doctor to another. So we want to provide those coordinators. There are a whole series of tools we're providing to our customers which give you transparency regarding doctors' credentials, pricing, and alternatives to the emergency room. So what do we provide? The core of our service is 24/7 access to a physician, complemented by the opportunity to talk to a healthcare advocate who can help you through serious issues, both with your doctors and with your insurance company. In order to talk with them, we create, or we allow our members to create a healthcare record, which they can share as they wish with the doctors within our system, with our healthcare advocate, and with their own doctor. We then provide them a series of tools, which includes access to 9,000 articles about various disease conditions written for patients, but written at a very high layman's level for patients. So not as simple as some of the stuff you find online and not as complex as clinical data. We give you a database essentially of every practicing doctor in the United States, which you can search and sort. We also give you databases of ERs, urgent care centers, walk-in, and we give you walk-in clinics, and we give you tools that will allow you to do some pricing. This is what our dashboard looks like. When you start with us, you fill out your healthcare form. It takes about 3 minutes, and you're set to go. Once you've done that, you have a patient homepage. That patient homepage tells you about the consultations you've had to date, gives you some news, which is customized both to your medical record and to any other things you've told us you're interested in. And then it gives you toll-free access to both our doctors and our patient advocates. So it's 6 o'clock, Saturday evening. Your son has the hives. Your doctor's not answering the phone. You don't know exactly what to do. You need information, and you may need action. So you do a search on hives, and what we do is we give you a body of information that tells you what is hives, what causes it, what are some of the treatments for it. We give you some information about the pricing for those treatments. We then tell you who some of the physicians in the area are who can handle that, and we give you information about where the urgent care centers are, walk-in clinics, and ERs that you might want to go to. Before you do any of that, though, you should probably talk to one of our doctors. This is an example of a consultation I had last year with one of our doctors. I had a particular issue. I called him up. Within about 5 minutes, I had resolved that issue, i.e. that I didn't have to go to the emergency room. And I can go back and review that. It's recorded, and it's available to you. The doctor may suggest that you take your son, who has hives, at 6 o'clock on Saturday to the emergency room. He may say calamine lotion is enough. But you have the security of having a professional be able to advise you on which action to take, and then we give you the tools to take those actions. Here's an example of how you might find a healthcare center. In this example, we have Yelp reviews, where we'll be adding other reviews to the site as well from various locations. So, what's our value proposition? You come to us with a problem. Our technology platform allows you to blend information and consultation with healthcare professionals. What we've done is we've created a patient-centric, easy-to-use, integrated healthcare platform. And our whole goal is to have you leave with a solution, and it's a subscription model that costs a few $100s a year. Initially, we're targeting middle-class insured consumers. It's a freemium internet marketing model. An annual subscription runs $250 to $750. Sorry, I'm in the healthcare business. 1,000 is always there. Basically, once we've figured out exactly what patients want, we plan to take this to physicians as a way to extend their service into a concierge business, take it to employers as a way to help them both reduce costs and save time for employees who are away from work. And then finally, we may want to talk to insurers. We've also created proprietary databases that we think we can license, and we have advertising when we get to a certain size. Thank you.
I'm curious how you select the doctors that participate in your program, and is there any kind of background or bios that you provide the consumers so they have some knowledge of where they come from and what their expertise is?
We have about 250 doctors who are available by telephone. Their bios are available to all of our users. Most of them are board certified. Not all of them are board certified, but most of them are board certified. And what happens is when you have a problem, you call up, and there is a system by which a doctor is on duty. If for some reason that doctor is occupied temporarily, it rolls to the next doctor. So you never know exactly which doctor you will get. If you get a doctor not in your state, that doctor can then connect you to a doctor in your state in the event you need a prescription. So it's basically 250 doctors who are there. Dozens of them are on duty at any given time to assist you with your needs.
The question is, does your $250 a year include the doctor call, or is that an additional fee?
It does. And it includes a certain number of hours of consultation with a healthcare advocate. It's not unlimited consultation with a healthcare advocate. It is unlimited consultation, initial consultation with a doctor. If you need a more advanced and detailed consultation with a doctor, each level of subscription has different access. We start with one of those and go up to unlimited.
Hi, Patrick.
Hi.
When you do speak to the doctor, do you have the opportunity to share imagery, like pictures or video? Because a lot of symptoms could be different for different.
There is a Skype teleaccess. Almost nobody uses it. The doctors aren't quite ready for that, and the patients aren't quite ready for that. What you can do, and what I've personally done, is I've uploaded images and records from my personal primary care physician into this so that the doctor I'm talking to on the phone has all of my background, including video MRIs and that sort of thing if you need that.
Pat, how do you, lack of a better word, inoculate yourself from possible liability giving advice over the phone in this manner, with malpractice being such an issue for doctors?
Well, we live in a country with the largest number of lawyers per